let's talk about something that millions of men search for online every single day, but rarely get honest, scientifically accurate answers about. I'm Dr. Mia Carter, a urologist with years of experience, and today we're addressing one of the most common questions I get asked in private consultations. Can you actually increase penile length? And if so, what methods are proven by science? Now, before we dive in, I want you to know this video is based on peer-reviewed medical research, not internet myths or marketing hype. We're going to separate fact from fiction, discuss what actually works, what doesn't, and most importantly, what's safe versus what could seriously harm you. And here's something crucial. I need you to understand right from the start. Most men seeking enlargement actually fall within the normal range. But we'll get into that. So, if you're serious about understanding this topic from a medical perspective, stay with me through this entire video. By the end of this video, you'll know what the actual average measurements are, and why most men have nothing to worry about, the only scientifically proven surgical method that actually works, non-surgical options that have legitimate medical evidence, the dangerous scams that could permanently damage you, and the psychological factors you need to consider before pursuing any intervention. This information could save you thousands of dollars and protect you from potentially irreversible harm. So, let's get started. Section 1. The reality check. First, we need to establish baseline facts, because here's what I see in my practice constantly. Men who are completely normal thinking they're below average. According to a comprehensive study published in the British Journal of Urology International that analyzed data from over 15,000 men, the average erect length is between 5.1 and 5.5 inches. The average flaccid length is 3.5 to 3.9 inches. Now, here's what's interesting. When researchers surveyed men about their perception, they found that men consistently underestimate where they fall on the spectrum. This is partly because of unrealistic portrayals in adult content, which often uses camera angles, selection bias, and sometimes even digital enhancement. I have patients come in saying they're small when they're actually at the 60th percentile. The psychological component here is significant, and it's often rooted in what we call locker room syndrome, or comparisons to unrealistic standards. So before we talk about any interventions, ask yourself, am I seeking this because of a genuine medical issue or because of anxiety and comparison? Because if it's the latter, the solution might not be physical at all. Studies show that counseling and body image therapy can be more effective and safer than any physical intervention for men in the normal range. That said, there are men with a condition called micropenis, defined as a stretched penile length of less than 2.75 inches in adults, and there are legitimate medical interventions for this condition. There are also men who've experienced penile shortening due to surgery, Peyronie's disease, or other medical conditions. For these cases, medical intervention is appropriate. Section 2. What doesn't work? Now let's talk about what you've probably seen advertised online. I need to be brutally honest here because these scams prey on men's insecurities and cost people millions of dollars every year. Pills and supplements. There is zero scientific evidence that any pill, herb, or supplement increases penile length. None. The FDA has issued multiple warnings about these products. Some contain hidden pharmaceutical ingredients that can interact dangerously with other medications, especially if you're taking nitrates for heart conditions. Save your money and protect your health. Pumps for enlargement. Vacuum erection devices can help with erectile dysfunction temporarily, but they do not permanently increase length. Any size increase is temporary due to fluid retention and goes away within hours. Extended use doesn't lead to permanent growth. Extenders and stretching devices. Here's where it gets nuanced. Some traction devices have shown very modest results in clinical studies, but we're talking about 0.5 to 1 inch over 4 to 6 months of wearing the device several hours daily. The compliance required is extreme, the discomfort is significant, and the results are modest at best. The quality of evidence is also debated in the medical community. Jelqing and manual exercises. Despite internet forums claiming these work, there's no scientific evidence supporting manual stretching exercises. Worse, aggressive jelqing can cause scar tissue formation, erectile dysfunction, and permanent damage. I've treated complications from these techniques. Section 3. What actually has evidence? Alright, so what does work according to medical science? Option 1. Penile lengthening surgery, ligamentolysis. This is the only surgical procedure with established evidence for increasing flaccid length. The surgery involves cutting the suspensory ligament that attaches the penis to the pubic bone. This allows the internal portion of the penis to drop forward, increasing visible flaccid length by typically 0.5 to 1 inch. But here's the critical information. This procedure usually only increases flaccid length, not erect length. The trade-offs include decreased stability during erection, a lower angle of erection, visible scarring, and months of post-operative traction device use to maintain gains. Complication rates vary, but can include infection, scarring, loss of sensation, and dissatisfaction with results. This is not a minor cosmetic procedure. It's major surgery with significant risks. Option 2. Dermal fat grafting or fillers. Some surgeons offer procedures that increase girth, not length, through fat transfer or injectable fillers. Results are inconsistent, absorption rates are unpredictable, and complications can include lumping, irregularity, and migration of material. Option 3. Weight loss. Here's something practical that actually works for many men: losing abdominal fat. For every 30 to 50 pounds of excess weight, you can lose about half an inch of visible length because it becomes buried in suprapubic fat. Losing weight can reveal 1 to 2 inches that were hidden. This is the safest, healthiest intervention for overweight men, and it comes with cardiovascular and overall health benefits. Option 4. Grooming. Simply trimming pubic hair can make you appear larger. This sounds basic, but visual perception matters psychologically. Option 5. Treating Peyronie's disease. If you have curvature or plaque formation causing shortening, treating the underlying Peyronie's disease with medications like Xiaflex or surgery can restore lost length. What about platelet-rich plasma, PRP, or stem cells? These are being researched, but the evidence is preliminary at best. Most offerings are not FDA approved for this purpose and should be considered experimental. Be very skeptical of clinics making big promises with these treatments. Section 4. The psychological component. Here's what I really want you to understand. The vast majority of men seeking enlargement have normal anatomy but distorted perception. Research published in the Journal of Sexual Medicine found that partner satisfaction has virtually no correlation with penile size within the normal range. Technique, emotional connection, communication, and overall sexual competence matter far more. If your concern is affecting your confidence, relationships, or mental health, I strongly recommend speaking with a sex therapist or psychologist who specializes in body image and sexual health. This isn't weakness, it's addressing the actual root cause. There's also a condition called penile dysmorphic disorder, similar to body dysmorphic disorder, where someone has a distorted view of their body. No amount of physical intervention will resolve a psychological issue. I've seen men go through expensive, risky procedures only to remain dissatisfied because the problem was never physical to begin with. Don't let that be you. Section 5. The bottom line. So here's my medical advice as a urologist. 1. If you're in the normal range, and statistically, you probably are, the risks of intervention outweigh the modest potential benefits. Focus on overall health, fitness, and sexual technique instead. 2. If you're considering surgery, consult with multiple board-certified urologists, not cosmetic surgery clinics making bold promises. Get second opinions. Understand that results are modest and complications are real. 3. Avoid anything not backed by peer-reviewed research. If it sounds too good to be true, it is. Your sexual health is not worth gambling on unproven treatments. 4. Consider the psychological aspect seriously. Many men find that addressing body image concerns and improving confidence yields better outcomes than any physical intervention. 5. Remember that satisfying sexual relationships depend on far more than measurements. Communication, technique, emotional intimacy, and mutual respect matter infinitely more. If you have genuine medical concerns, micropenis, Peyronie's disease, post-surgical shortening, or significant erectile dysfunction, absolutely see a urologist. These are legitimate medical issues with treatment options. But if you're a normal guy who's been affected by unrealistic standards, know that you're likely just fine exactly as you are. I hope this video gave you honest, science-based information on a topic that's surrounded by misinformation and predatory marketing. If you found this helpful, please like this video and subscribe to True Wellness Network for more evidence-based men's health content. Drop a comment below if you have questions. I read them and try to respond when I can. And remember, your worth isn't measured in inches. Take care of your overall health be a good partner, and don't fall for scams that prey on insecurity. Thanks for watching, and I'll see you in the next video.